Hello everyone, and welcome back to my channel. Thank you for joining us today. It's a pleasure to be with you as we delve into a topic that affects millions of people around the world, eye health. Our eyes are vital organs that allow us to experience the beauty of the world around us, yet there are numerous diseases that can pose significant threats to our vision and overall eye health. Today, we will be discussing the 5 most dangerous eye diseases, conditions that can lead to severe visual impairment or even blindness if not detected and treated in a timely manner. We'll explore each disease, understand its symptoms, risk factors, and the latest advancements in treatment and prevention. So, whether you're someone who is concerned about your own eye health, a caregiver, or simply curious about the topic, I hope you find this information enlightening and empowering. Let's take a closer look at these critical issues and learn how we can better protect our precious sight. 1. Glaucoma. Glaucoma is a group of eye conditions that can damage the optic nerve and cause vision loss. It is often referred to as the silent thief of sight because it usually has no symptoms until it has progressed to a more advanced stage. The most common type of glaucoma is called primary open-angle glaucoma, which is usually caused by high pressure in the eye that damages the optic nerve. There is also angle closure glaucoma, which occurs when the drainage angle of the eye becomes blocked, leading to a sudden increase in eye pressure and symptoms such as severe eye pain, headache, blurred vision, and halos around lights. Regular eye examinations are important for early detection and treatment of glaucoma, as it can be managed effectively with medication, laser treatments, or surgery to lower intraocular pressure and prevent further damage to the optic nerve. It is important to follow your eye doctor's recommendations and treatment plan to protect your vision and prevent vision loss from glaucoma. 2. Macular degeneration. Macular degeneration is a leading cause of vision loss in people over the age of 50. It affects the macula, a part of the retina responsible for central vision. There are 2 types of macular degeneration, dry and wet, with the wet form being more severe and leading to rapid vision loss. Macular degeneration, also known as age-related macular degeneration (AMD), is a chronic eye disease that affects the macula, which is the central part of the retina responsible for sharp, central vision. AMD is a leading cause of vision loss in people over the age of 50. There are 2 main types of AMD, dry AMD and wet AMD. Dry AMD is the most common form and progresses slowly, resulting in a gradual loss of central vision. Wet AMD is a more severe form that can lead to rapid and severe vision loss. Wet AMD is characterized by the growth of abnormal blood vessels under the macula that leak blood and fluid, causing damage to the macula. Symptoms of macular degeneration may include blurry or distorted central vision, difficulty seeing clearly in dim light, and the appearance of dark spots or distortions in your vision. Regular eye exams are important for early detection of macular degeneration, as early intervention can help slow the progression of the disease and preserve remaining vision. Treatment options for AMD may include nutritional supplements, injections into the eye, laser therapy, and low vision aids to help manage symptoms and improve quality of life for those affected by the disease. It is important to work closely with your eye care provider to monitor and manage macular degeneration effectively. 3. Diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina. It can cause vision loss and even blindness if left untreated. People with diabetes are at a higher risk of developing diabetic retinopathy, particularly if their blood sugar levels are poorly controlled. Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina, the light-sensitive tissue at the back of the eye. It is a leading cause of blindness in adults with diabetes. Diabetic retinopathy develops over time as high blood sugar levels damage the small blood vessels in the retina. There are 2 main stages of diabetic retinopathy: non-proliferative diabetic retinopathy, NPDR, and proliferative diabetic retinopathy, PDR. In the early stages of NPDR, blood vessels in the retina weaken, leak, or become blocked, leading to decreased blood flow and oxygen supply to the retina. As the disease progresses to PDR, new abnormal blood vessels start to grow on the surface of the retina and into the vitreous gel of the eye, which can cause bleeding, scar tissue formation, retinal detachment, and severe vision loss. Symptoms of diabetic retinopathy may include blurred or distorted vision, floaters, spots or dark strings floating in your vision, a dark or empty area in the center of your vision, and difficulty seeing colors. It is important for people with diabetes to have regular eye exams to monitor their eye health and detect diabetic retinopathy early. Treatment options for diabetic retinopathy may include laser therapy, injections of antivascular endothelial growth factor, VEGF, medications, and vitrectomy surgery for more advanced cases. Controlling blood sugar levels, blood pressure, and cholesterol through lifestyle changes, medication, and regular medical care are crucial in managing diabetic retinopathy and reducing the risk of vision loss. It is important to work closely with your healthcare team, including your eye doctor, to protect your vision and overall health when living with diabetes. 4. Retinal detachment. Retinal detachment occurs when the retina, the light-sensitive tissue at the back of the eye, pulls away from its normal position. If left untreated, retinal detachment can lead to permanent vision loss. Symptoms include sudden flashes of light floaters and a shadow or curtain covering part of your visual field. Retinal detachment is a serious eye emergency that occurs when the retina, the thin layer of tissue at the back of the eye that processes light, pulls away from its normal position. This separation can cause vision loss or blindness if not treated promptly. Retinal detachment can occur due to various factors, including aging, trauma to the eye, or underlying eye conditions. Symptoms of retinal detachment may include sudden onset of floaters, tiny dark spots or lines that float in your vision, flashes of light in the affected eye, blurred vision, a shadow or curtain blocking part of your vision. If you experience any of these symptoms, it is crucial to seek immediate medical attention from an eye care professional. Treatment for retinal detachment often involves surgery to reattach the retina and prevent further vision loss. There are different surgical approaches for retinal detachment repair, including laser surgery, cryopexy, freezing, pneumatic retinopexy, gas injection, scleral buckling, placing a band around the eye, or vitrectomy, removal of the vitreous gel inside the eye. Early diagnosis and treatment of retinal detachment are essential in preventing permanent vision loss. Regular eye exams and prompt attention to any changes in your vision are important for maintaining eye health and preventing complications such as retinal detachment. 5. Uveitis. Uveitis is an inflammation of the uvea, which is the middle layer of the eye that includes the iris, ciliary body, and choroid. It can lead to vision loss if not treated promptly and properly. Uveitis can be caused by infections, autoimmune diseases, or trauma to the eye. Symptoms include eye pain, redness, light sensitivity, and blurred vision. Uveitis is an inflammation of the uvea, which is the middle layer of the eye that includes the iris, ciliary body, and choroid. Uveitis can be a serious eye condition that can lead to complications and vision loss if not treated promptly and effectively. Uveitis can be caused by infections, autoimmune diseases, trauma to the eye, or underlying systemic conditions. There are different types of uveitis based on the part of the uvea that is affected. 1. Anterior uveitis. Iritis. Inflammation of the iris is the most common form of uveitis, affecting the front part of the eye. Symptoms may include eye pain, redness, light sensitivity, blurred vision, and constricted pupil. 2. Intermediate uveitis. Inflammation of the ciliary body and vitreous humor, middle part of the eye. Symptoms include floaters, blurry vision, and painless inflammation. 3. Posterior uveitis. Inflammation of the choroid and retina at the back of the eye. Symptoms may include floaters, blurry or distorted vision, and decreased central vision. 4. Panuveitis. Inflammation involving the entire uvea. This type of uveitis can cause severe vision impairment and may be associated with systemic inflammatory diseases. Treatment for uveitis may include anti-inflammatory medications, such as corticosteroids, immunosuppressive drugs, dilating eye drops, and in some cases, surgery. Prompt diagnosis and treatment by an eye care professional are important to reduce inflammation, alleviate symptoms, and prevent complications such as vision loss, cataracts, glaucoma, and retinal damage. Regular eye exams and monitoring by an eye doctor are important for individuals with uveitis to manage the condition effectively and maintain eye health. If you experience symptoms of uveitis, such as eye redness, pain, sensitivity to light, or vision changes, it is important to seek prompt medical attention. Preventing the 5 most dangerous eye diseases, glaucoma, macular degeneration, diabetic retinopathy, retinal detachment, and uveitis, involves a combination of lifestyle practices, regular eye exams, and early detection. Here are some general tips on how to prevent these conditions. 1. Regular eye exams. Visit an eye care professional for routine eye exams, even if you have no symptoms. Regular screenings can help detect eye diseases early when they are most treatable. 2. Maintain healthy lifestyle habits. Adopting healthy lifestyle practices can benefit your eye health. This includes maintaining a balanced diet rich in fruits, vegetables, and fish high in omega-3 fatty acids, exercising regularly, managing chronic health conditions like diabetes and hypertension, and avoiding smoking. 3. Protect your eyes. Wear protective eyewear, such as sunglasses that block out UV rays, safety glasses, and goggles when engaging in activities that could lead to eye injury. 4. Maintain proper eye hygiene. Practice good eye hygiene, such as washing your hands before touching your eyes, removing makeup before bed, and avoiding sharing eye cosmetics or contact lenses. 5. Know your family history. Some eye diseases, such as glaucoma and macular degeneration, have a genetic component. Knowing your family's eye health history can help identify your risk factors and enable early intervention. 6. Manage systemic diseases. For individuals with conditions like diabetes, it is crucial to manage blood sugar levels through diet, exercise, medication, and regular medical care to prevent diabetic retinopathy and other diabetes-related eye complications. 7. Prompt attention to symptoms. If you experience any changes in your vision, pain, or discomfort in your eyes, seek prompt medical attention from an eye care professional. By incorporating these preventive measures into your daily routine and maintaining regular eye exams, you can help reduce your risk of developing these dangerous eye diseases and protect your vision for the long term. Thank you so much for tuning in. If you enjoyed this content and want to see more, don't forget to give us a thumbs up, share it with your friends, and hit that subscribe button. Your support